Our son Matthew was 6 months old. He started having congestion, and we had been going to the pediatrician's office pretty much on a weekly basis. The day that we took him into our local hospital here in Flint, he was very much struggling with his breathing. The ultrasound found that he had an infection in his neck, a retropharyngeal abscess, and the nurse practitioner at the time called ahead to Michigan Medicine and said the survival flight crew could be there in a short period of time. Just hearing the helicopter coming into the hospital just provided us a really good sense of relief that we didn't have to carry the burden of trying to save our son, that survival flight was coming.
So to be frank, for a lot of our patients, it's life or death. A lot of times, especially when we're going to small remote hospitals and we're providing care at these smaller facilities, and they've already reached their max capacity to take care of the patient, and the patient's still not doing well. When we show up, we're able to escalate care in a way that they don't have the ability to do so. And so when we get to the bedside, you almost see them, breathe a sigh of relief, like, oh my gosh, they're here.
One of the reasons that I picked to work at Survival Flight is there's nothing that we can't do. If anyone calls us, no matter where it is in the state, number one, we can go to it. We can also go out of state. Our motto for us is we can take anyone, but we're a critical care transport team. And that just means anyone who's in the ICU, anyone who's in an ER, we have the capability of taking you, no matter what's going on and no matter where you're at. Obviously, you hear U of M Survival Flight, you think Michigan, U of M, but we have the capability to go anywhere and do anything.
Every patient, if there's a sliver of hope, that we provide that hope, that we are that hope, that we represent that hope to everyone who looks up in the sky and sees that bird landing or sees that bird flying over, that they know that that means that there's a chance. Whether you're in Ironwood, Michigan, you're in Marquette, Michigan, Alpena, St. Joe's, Grayling, it doesn't matter. If there is a way we can overcome an obstacle, whether that obstacle be logistical, whether that obstacle be financial, whether that obstacle be someone is scared of flying and doesn't want to get in the helicopter, whatever it is, we figure out a way to get through that so that we can be the hope for the state. I think that should be the future of survival, and I don't think there's probably a bigger honor out there. If we could be that, if we could represent a unifying force for healthcare access in the state of Michigan, I'm not so sure that there's much more we could ask for.
They just had it together. They came right in. They worked so well with the hospital team that was already caring for our son, and they just took control. They took absolute control. They brought in Michigan Medicine's care standards. They told us the action plan. They called ahead to their OR surgical team. We just wanted to make sure our son was getting the best care and that he was going to make it. And it's because of Survival Flight that he made it.